Radiography interviews are a lot harder than people expect. Whether you're applying for university or an apprenticeship, whether it's diagnostic radiography or therapeutic, I see people make the same mistakes again and again. It's not because they lack passion or confidence, it's usually because you're not using the right keywords in your interview. And often this is a thing that they don't really teach you at school or college, how to approach NHS interviews, specifically radiography interviews. What they are really testing you on is your communication, your teamwork, your ability to show judgment, empathy, understand ethical scenarios, and approach them systematically. They're looking for your ability to be safe around patients, to understand the role inside out. So I'm going to go through the most common interview questions, how to approach them, and the framework that you need to stand out. I've helped hundreds of applicants with their personal statements, securing interviews, interview coaching, and helping them to land offers. So this preparation is really going to help you stand out. Now, if you do want the full personal statement guide or the interview guide, the links will be in the description, and that's going to have a whole list of common interview questions that have come up before, as well as model answers to ethical scenarios, NHS value questions, and skills-based questions as well. No matter which university or apprenticeship that you apply to, these interview questions fall into 4 main categories. The first one are general motivation questions, which is where they try and understand you, your why, your purpose, your passion. Where has that come from? What has prompted you to apply to radiography? That could involve talking about your work experience, tell me about yourself. The questions where they try and get to know you. They don't just want to know your name, they want to know your name, your background, your work experience, what you've studied, what has motivated you, what has led you to this career. Was it volunteering? Was it a career experience? Was it a personal experience? That will include questions like why radiography, why this university, or why this hospital. Then you've got skills-based questions. Skills-based questions come up at every single interview. The most common skills that they ask about are things like communication, teamwork, empathy, problem solving, manual dexterity, so being able to be practical. They want to know how you've built these skills. You understand which skills are necessary, which qualities are necessary for a radiographer to have, and they want to see exactly how you've built those skills and how you're continuing to develop them. For example, tell me about a time that you had to solve a problem alongside a team. These questions can also be, how have you improved your communication skills? Tell me about a time that you had to communicate with an older group of patients. Tell me about a time that you had to communicate with a younger group of patients. Remember, radiographers treat patients of all different ages. It's really important to show that you've worked with diverse groups, whether it's working in a school, working in a hospital or care home, or working in a retail job. You've spoken to lots of different types of people, and they want to see that come through. So they don't just want you to say, I have a passion for this, I can communicate really well, but give evidence to follow up your answers. The next group of questions are NHS values-based questions or ethical-based scenarios. This is where they're testing your judgment. They give you a situation and they want to see how you'd manage it. Would you be a safe practitioner? Would you work well in a team? This could be based around consent issues, confidentiality, doing what's best for a patient, understanding what's not safe. You could even have a multiple mini interview, which could involve stations which cover more scenarios or role play scenarios where you have to act out how you would act appropriately or safely in a situation, or you could be speaking to a patient in that role play and they just want to test your communication when under pressure. This could be things like managing an anxious patient, a difficult situation, maybe a conflict within a group scenario. And if you prepare for these 4 categories, motivation, skills-based questions, NHS values, and ethical and role play scenarios, then you are going to be ahead of 80% of applicants. Now, for motivation-based questions, this is where you really need to talk about yourself, your background, give more information than you think they're expecting. When they're saying, tell me about yourself, they really want to hear your name, your background, where you're from, what your situation is. Are you currently working? Are you at college? What have you studied? What has motivated you? What have you done beyond the college environment? Did you do a work experience that really motivated you and led you to radiography? What is it that makes you stand out? And then you can even mention a couple of hobbies or things that you do outside of work. I've got really good model answers that you can use as a framework, which is going to be in the guide. Now, skills-based questions. I really want to focus on this because skills-based questions come up at every single interview, and they can be the majority of the interview questions. Now, skills-based questions will be things like, tell me about your communication, problem-solving skills, your leadership, your ability to work in a team. You have to prepare examples for every single type of skill. So prepare an example of a time that you worked in a team, a time you had to lead a team, a time that you had to solve a difficult problem. This could be like you're working on a school project and you had to face a difficult situation when maybe somebody dropped out of the group, and you have to give an example of maybe a time where you stepped up or you had to solve that problem together. That's really, really important to give examples and also to integrate the NHS values into your answer. Now, for skills-based questions, you really want to use the STAR method. This is situation, task, action, result, and reflection. And remember, reflection is the most important part. There was a situation where I was working on a group project and somebody had to drop out. I was tasked with redistributing the workload, and I took action by setting up a group meeting for everyone to discuss the next steps and figure out what needed to be done, which priorities were remaining, and how we could distribute that across the group. As a result of us having regular team meetings, having follow-up sessions, and redistributing the workload, we were able to achieve the mark that we needed and get the work done in a timely manner. In reflection, it was really useful to have team meetings, to have really good communication, to listen to one another and work together in order to achieve the same goal. It was really, really important for somebody to take lead and set up the meetings and not to stress, but allocate our time correctly, make sure we had a schedule. So what you're really doing is plucking out the skills in that reflection part. You can even relate that back to radiography. Equally in radiography, we're going to face challenges like X, Y, Z, and using these skills will help us to tackle them in the future. Now for the NHS values-based questions. For this one, you do need to learn the 6 NHS values. These are some NHS values that you need to learn, and you need to know them inside out because you can apply them when you're talking about any situation or scenario. For example, a situational judgment question could be, what would you do in a situation where you're working in the radiography department, but the equipment fails and it's no longer working, but you have 20 patients lined up to see for x-rays? What are you going to do in that situation? Now, it's not about having the perfect answer. In fact, I don't really think there is a model answer for ones like this. What they want to see is good systematic structure. How are you going to approach it? Who are you using around you? How you're reflecting on it. Think about the NHS values and qualities that come into this. Here's how I would approach it. First, repeat back the scenario. In this situation, I understand that the equipment in the department has failed. I'm not sure if other equipment is available to use. In this case, I'm assuming these patients cannot be seen for their x-rays because the equipment has stopped working. My priority in this case is always making sure that the equipment is safe to use, and I'm prioritizing patient safety. I'm also aware that these patients need to have their x-rays done, so I need to make a plan on how they can be seen or how the equipment can be fixed. The first thing I'd want to do is make sure that I stopped using the equipment straight away. That is prioritizing patient safety and making sure that no one is at risk of harm. The second thing I would do is try and find a senior member of staff, a supervisor, a senior radiographer, somebody that I could alert and make them aware that the equipment has failed and no longer working. That way we can follow whatever protocol exists to make sure that the equipment can get fixed as quickly as possible. So that could involve calling an engineer. The third thing I'd need to do is make sure that the patients are aware that there's a delay or that they possibly won't be able to be seen unless they have to be reallocated to a different radiographer. So whilst the equipment and issues are being addressed, I'll be very honest and transparent with the patients, make sure they're well informed. I'd have to do this by communicating effectively. I'd also have to show empathy and understand how the patients might be feeling. They may have already waited a few hours and there could be frustrations with that as well. And I would work as part of the team, maybe working with the receptionist to make sure that that patient list could be reallocated to other radiographers or other departments to make sure that they can be seen safely, or postponing their x-rays to a later date. Throughout this, I'd be as calm as possible, make sure that I'm professional, make sure that everything is followed up, protocol is followed up. If it's the first time that I've dealt with equipment failure, maybe brushing up on my knowledge of what to do, what the protocols are for that situation, because radiographers have a responsibility to maintain the safety of patients. So after the situation, it's really important to reflect, how could I have dealt with it better? What would be a red flag in that situation is saying that I'm going to try fix it myself, not using the team around you, or escalating and just telling the patients, look, you need to go home. You need to be using the team around you. Acknowledge patient safety, acknowledge how the patients are feeling, and drop in those NHS values about showing compassion, empathy, respecting patients. All of those come into play when you're talking about situations. Now, role plays. They don't always have role plays in interviews, but I've heard a lot of apprenticeship radiography interviews and university interviews now implementing role plays. And they really want you to talk through it and just show empathy, show that you're listening. I can't emphasize this enough. You do need to prepare for your radiography interviews. It is not a walk in the park. You need to know what a radiographer does inside out, their qualities, what their day-to-day roles are. If you haven't done any work experience, maybe do some virtual work experience. Look up their roles, responsibilities, their qualities, their skills, and think about how you've developed those skills. Full details of roles, responsibilities, about 15 ethical scenarios are in the interview guide, as well as role play station examples, how to manage anxious patients, keywords, phrases to use to show that you're listening and to show that you have empathy. All of that is going to be in the guide, but I'm going to make as many more videos as I can on this. Let me know in the comments if you found it helpful.